is Humayun Kabir. I'm a student nurse from Western Sydney Uni. I'll be looking after you today. How are you? Alright. According to your medication charts, you are due for the morphine. But before I administer that medication, I need to check your details to make sure you are my right patient. So could you tell me your full name, please? And what's your date of birth?
7169.
7169. That's correct. Can I check your arm range? 67, 512. That's good. Thank you very much. Are you allergic to anything?
No.
Alright. How are you feeling now? Okay.
Yes.
Alright. Which side is it?
On my left eye.
Okay, Adi. If I ask you for pain score from 1 to 10, how is it score?
8.
8. Alright, I can see. Alright, I'll get to you shortly. So by this time, if you need any help for the bus, I'll get to you shortly. Thank you very much. Excuse me, sister. I have a patient, say, Adik Mehari. Sir, MRN number 174963.
Yep.
And I check with her armband as well as, and her date of birth 7/1/1969.
Yep.
And she's nil allergies. I check with her armband as well as, and she got medications for morphine 50 milligram in 50 ml, which is reason for the history of posterior fracture ribs.
Yep.
And there's the morphine 50 milligram 50 ml, which is concentration is 1 milligram in 1 ml.
Yep.
And number of syringes 3, and PCA dose 1, and the is lockout interval time is 5 minutes.
Yep.
And the basal infusion is 0 milligram an hour. The hourly dose limit is 12 milligram. And doctor's initial here, doctor signed and print the names as well as and the dates. And the patient's weight mentioned here 62 kilograms. And there is alternative medications as well as for the antiemetic medications, which is metronidazole, the 10 milligram, which is especially for the nausea and vomiting, and it's TDS. And another medication for naloxone, which is as well as for the overdose. And the today's date is the no one given yet. So I think it's valid. Or are you agree with me?
Yes.
Thank you. Okay, I checked the main system. So according to the minimum, there is the dose is 0.5 milligrams to 1.5 milligrams per dose, and there's some the adverse reactions, respiratory depressions, GI upset, drowsiness, and sort of things. I'll explain to the patients as well as, and I'll by this time I'll get all the equipments. Are you happy with that? So I try to gather my equipments and collect the morphines as well. So would you mind to come to the cupboards, please? It's 44. So by this time I can do my first drug check as well as, if you don't mind. So this is sister, there is my first drug checks. I got a patient here, the Adib Mary. The date of birth is 7/1/1969.
Yep.
And MRN number 174963. I check with her armband as well as the history of posterior fracture ribs.
Yep.
And the allergies is nil known allergies. I check with her armband. And the patient's weight is 62 kilograms, and she is due for the morphine, which is 50 milligram in 50 ml, is PCA dose IV medications, and there is concentration is 1 milligram in 1 ml, and number of syringes is 3, PCA dose 1, and the lockout interval is 5 minutes time. Basal infusion is 0 milligram, and the hourly dose limit is 12 milligram. Doctor's initial here, and doctor's print name and sign as well as the date here. And today's date, no one given yet. Are you agree with me?
Yes.
Thank you. So today's date is 9th of 5/17. The time is 11:35. The patient's name is Miran Adib, and the amount given is 50 milligram. And the balance I'm going to check. The doctor's name is L. Hunt. And 7,000. Signature HK-18082047. Okay, sister. So according to my calculations, there's the medicine is the morphine is 10 milligram. So is 2 ml, 10 milligram in 2 ml. But my medication total volume is 50 milligram in 50 ml. So 50 milligram in 2 ml. So I need 5 of them. So 5 vials. So there is 6 left. So I'm gonna take from here 5, and 1 is left. 1 is left, so I put it back in the container. So I took 5, so 1 is left, so the balance is 1, and this is my son. So could you sign for me as a witness, please? Alright, thank you, sister. Thank you very much. So by this time I can do the first job check here as always with you. So this is my first job check with medication, some which is morphine. So I got a patient Adit Meherin, and it's the nil allergies nose. I check with his patients, and I check with his armband as well as, and the morphine 50 milligram in 50 ml. Which is the PCA dose and connected with the IV, and the lockout time say 5 minutes, and the hourly dose limit is 12 milligram. Doctor's initials here, and today is no one given yet. And the medication is morphine sulfate injections 10 milligram in 2 ml. 10 milligram in 2 ml, all are same. So its expiry date is 10/20, which is acid drugs. So are you happy with that? Thank you very much. Okay, sister, that's the part of my first year check. As well as I check with you the morphine 5 ampoules, which is the expiry date and the volume rate. But now I need to dilute with the 0.9%, which is sodium chloride PP. I need to dilute with the morphine with this, and this is the 40 ml here, because the total volume is 50 ml, so there is 10 ml in the morphine, and there is 40 ml with the sodium chloride, and which is expired is September 18, sorry, and September 18, and September 18, which is 10 ml, 10 ml, 10 ml, and 10 ml, so altogether 40 ml, and another 10 ml is the morphine. Are you happy with my first check?
Yes.
Thank you very much. Alright, sister, now I'm to the trunk, for the trunk. So I draw up to 40 ml normal saline.
Yes.
Now I'll add the morphine, which is 10 milligram in 2 ml. So I'll take from 5 of them. Okay, sister. So I put in the 5 ampoules and the 40 milligrams, 40 ml sodium chloride. So altogether is 50 ml here. Are you happy with this drawing?
Yes.
So thank you very much. Okay, sister. According to the medication, so now I'm going to do my second object. The date of birth is 7th 1st 1969, and MRN number 174963. I check with her ambient as well as the history of post-fracture ribs, and the allergies is nil known allergies. I check with her ambient, and the patient's weight is 62 kilograms, and she's due for the morphine, which is 50 milligram in 50 ml, is PCA dose IV medications, and there is concentration is 1 milligram in 1 ml, and number of syringes 3, PCA dose 1, and the lockout interval is 5 minutes time. Basal infusion is 0 milligram, and the hourly dose limit is 12 milligram. Doctor's initial here, and doctor's print name and sign as well as the date here, and today's date, no one give it yet. Are you agree with me?
Yes.
And that's the medications here: morphine, sulfate injections, which is according to my calculations, there is 5 ampoules because it's 10 milligrams in 2 ml. So my total morphine is 10 milligram. Total morphine is 50 milligram. So 10 milligram is 2 ml. So all of them are same. 10 milligrams 2 ml, 10 milligrams 2 ml, 10 milligrams 2 ml, 10 milligrams 2 ml, and all of them expiry dates is 10, 10, 20, 10, 20, 10, 20, 10, 20, 10, 20. On the other hand, there is sodium chloride, which is 0.9%, normal saline. I dilute with that. I draw as you've seen. So that's the expiry date is September 18, September 18, September 18, and September 18, 40 milligrams, and 5 ampoules, still 40 ml and 10 ml. So altogether is 50 ml here. I draw, which is ready to insert. Are you okay?
Yes.
Thank you very much. Now what I need to So this is my medication center. The patient's name is Adit Mehari. And ID is 1749639. Date of birth is 7/1/1969. Medicine is morphine. Units is 50 milligram in 50 ml, so 1 milligram in ml. Talent with normal saline. Today's date is 9/5/2017 and prepared by me, and the time, let's say approximately 11:55. Please could you send for me here? Thank you very much. Alright, that's my questions. Okay, I'm gonna add the level over here. That's it done. Now I have the line. Alright, there is no body yet. Okay, now at this moment. Alright sisters, I'm gonna ready for the connection of elements, so before that, This is new patient. Yes. The medication is morphine. 1 milligram is 1 ml. Is the lockout time 5 minutes. PCA dose is 1 milligram. So here morphine 1 milligram in 1 ml. 1 milligram is PCA dose. Lockout period is 5 minutes. So I'll go down. Is the maximum load limit. It should be 12 milligram. 12 milligram confirm. That's all. Okay. So now is according to the medication's PCA dose is the morphine 1 milligram in 1 ml. And number of chains is 3. PCA dose is 1 milligram. PCA dose is 1 milligram. Lockout time is 5. Lockout time is 5 minutes. Basal infusion is 0. Solution is 0. And maximum dose hourly limit is 12 milligram here. So I'll lock it up now. So start dose rate. I'll check until termo is okay. So now it's ready for connect, and then I'll press start button. Okay, Adip, it's me again. I just connected all your medications line syringe. So before I get administer the medications, I need to check your second patient check, if you don't mind. Could you tell me your full name, please?
Adib Miriam,
And your date of birth?
7169.
All right, and I'll check your MRN number. MRN number is okay. 746996. That's correct. Are you allergic to anything, Adib?
No.
All right. Thank you very much, Adib. So I'll check your femoral side now. Have a look. How it's going? Any swelling or redness or the date of the insertions? Okay, that's good. It looks good for me. So I'll come back to you to connect the lines for your morphine. Thank you very much, Adib. I'll be back shortly. Thanks. Okay, sister. So this is my heart draft check. I got a patient here, Adib Meherin. And date of birth is 7169. MRN number I check with the armband 174963, and it's not null energies according to I check with that twice. And that's the according to the PCA dose medications, there is morphine 50 milligram in 50 ml, and the concentration is 1 milligram in 1 ml, and the PCA dose is 1 milligram. Lockout interval is 5 minutes, and hourly dose limit is 12, and doctor's signature here. And today is no one given yet. And this is my medications according to my calculations. As I mentioned you before, there is a morphine, so is 10 milligram in 2 ml. So I needed 5 vials because to make 50 milligram. So there is 50 milligram in 10 ml, 2 ml each, and which is expiry date is 10/20. 10/20, 10/20, 10/20, and 10/20. And there is normal sodium chloride, which is 0.9%, is 10 milligram each, which expiry date is September 18, September 18, September 18, and September 18. So there is 40 ml and 10 ml here. So altogether is 50 ml already I inserted in the PC machine. So now I'm ready for connected to the patients. Is that okay? Thank you very much. Okay, Adif, I'll just wipe your canal side to make sure to do any contaminations or something else. Alright, so I'll connect your line. I check your vitals already, which is good between the flags, so should be fine, but let's see. there is like a pass to controller for your PC dose. So if you press here, it's going to be start your medication. So I'm going to do now, but if you want to control yourself, you can do it. And if you feel any dizziness or short, the respiration rate decrease or something like that, or any discomfortness, just let us know. Call the bars, we'll be back to you shortly. But it's 5 minutes lockout, but it's going to be finished soon. So I'll come back after that and to check your vitals again, how it's going with that. So this I'm gonna start now. So I press now. Is when I press, it looks flashing the green button. So you can see this is the PCA dose is inserting on your body. So is all right now. Medication is going on. But if you feel any discomfortness, you can press to stop, please. Thank you very much. Here you go. I leave on your side, and I'll seal your the lines. Alright, Adil, thank you very much. So now should be fine with your pain. Just I'll be back to you shortly.